Welcome to the INS, and certainly today we're celebrating first. And so one of the first people that I want to talk with is Mike Jonsk, who was involved in the first formation of the INS. Mike, can you give us some perspective on the formation of the INS?
Well, that's really long ago. In 1989, we have this first international meeting that was before the INS was founded in Paris in 1991. And we have so many problems because nobody knows what he actually was doing. So it was more on complications than on really neuromodulation. So we thought we have to provide a kind of floor for experts in the field. And my question to Michael now is, can you explain us a little bit what the INS has attributed to your work?
I think it's probably because when in 1994 we had our first meeting in Atlanta, Sam Hartzenbusch had already been in communication with the INS group, and he brought a lot of the early questions that were raised in that group to our group. Mm-hmm. And so my perspective is really one of just the growth of NANS, North American Neuromodulation Society.
But NANS is not really the INS.
No.
So my question was, what is the INS?
Well, yes.
You have some feeling with the INS, or it's only NANS that's important for you?
I honestly would say it was NANS because we were struggling to survive financially as well as developing a scientific and an educational function. So while I realized that there was an INS out there and that we were officially a chapter of the INS, that's my really only association during the early years.
But then the journal came along.
Yes.
Well, and the journal came along, and I think that really was an important, pivotal moment in the history of the INS and all of our societies. Elliot, you obviously created the journal and played a role in the. We had the founding of INS, then we had the progression of INS, and you were a major part of that. Can you tell us a little bit about that?
Sure. Well, I was in my kitchen one day cooking, which I like to do, and I get a telephone call from Giancarlo Barot, and Giancarlo was president of the INS at the time. And he said, "Do you know who I am?" I said, "Sure, I know you. I've read your papers." And he said, "Well, I'm the president of the INS." And he said, would you join our society and be on the board?" And I said, I'm honored to do so, and I did. And we had our first meeting, or my first meeting, was in Notwil, Switzerland. And I was so surprised because there were 9 people around the table, and I asked what the membership of the INS was, and they said 9 people. And I thought the INS was a big society because they had had several meetings prior to that. And I said, well, how can you be a society of 9 members? And they said, well, we have scientific meetings and we invite people and we advertise and people come. I said, well, if you're going to be a society, you need several things. You need a membership and you need a journal. A scientific society needs to have a journal. And they looked at me, and there was some discussion. Actually, there was some negative discussion, you remember, about that, about having a journal. And I think cooler heads prevailed, and they all voted yes, except one person, and you know who that is. And they looked at me and they said, "You start the journal." And I didn't really think that I could start a journal. I had no journalistic experience. I had been on an editorial board before, but I didn't know anything about it. So I went ahead and I started the journal, and we then became a society.
So let me ask Michael a question, Michael, about the international experience. We heard from Mike about the formation. What role has the international community played in your work, and your work on CRPS specifically, which you obviously have done the pioneering work for us?
Well, it's really been major because three of the players outside of Bonica, who was my mentor, were in Europe. There was Yannick in Kiel. There was I'm blanking, but there were three three people who were doing basic research work on CRPS. So I looked internationally all the time. There was not much going on in the United States at that time, during the 90s, and even early 2000, but certainly in the 90s there was not very much.
Very good. Mike, you've seen this study grow from the
Yeah,
beginning.
what I'd like to know, Michael, is what do you think is your biggest achievement in this field?
In CRPS,
Yes.
changing the taxonomy, because it's the taxonomy that has galvanized the research community, both basic scientists and clinicians. Without that common name, which is now used in over 80% of publications, now CRPS is used, that was the uniting factor. Before that, we were really in the waste basket of medical conditions.
And do you also know what's your biggest disappointment in this field? That it will
Yes,
work
that the as I tried to show in my talk today, that there was a separation of ideas between the neurological side and the inflammatory side, and both sides threw brickbats at the other.
That comes together, as you showed.
Well, it came together, but only during the last 10 to 15 years.
Okay, but that's my main question. How come that inflammation and sympathetics come together and you don't discuss the vagus, because the vagus is involved in inflammation?
Vegas never entered in the discussion.
It will.
Interesting. I know,
It will.
but it has not until now.
Okay, so that's the future. That's your future.
Well, it may be.
So, Mike, let me ask you about what you just said, though. So, I think you asked Michael a great question, about the vagus. And so, obviously, at this meeting, we have a lot of non-invasive things involving the vagus nerve and other things. That's one change. We have a whole symposium here on non-invasive neuromodulation. What have you seen since the beginning that you mentioned a moment ago till now? What have been the biggest things the INS has done to improve the field, and where have we fallen short so far that we can do better at? What would be those two things?
What I really see is that we were amateurs in the beginning, absolutely, as Elliot described. And now the field has grown and it's more really professional. The organization, newsletters, specifically the journal, but also the science is so much improved. It's now taken much more seriously than in the beginning when it was a kind of hullabaloo. And I think that is one of the things we have really, we're an esteemed society nowadays, to my knowledge.
I'd like to add something that's very important to the growth of this society, is that somewhere along the line, the board, I think it was Giancarlo Berlat that brought it to the board, was in the beginning we had one national chapter, and that's because of the work of both Michael and myself in trying to get NANS to join with the INS as a group. And in the beginning, you do remember, it was like we were accused of being foreign agents by some of the members of the NANS board. You remember that, Michael? But I think that one of the successes, the journal was certainly a success for the society, and the second success of the society was the establishment of national and regional chapters. I think that when we decided to do that, and we decided to go out
And this meeting?
and have the meetings were always there. They were scientific, but they've improved tremendously.
Yeah.
But getting people to feel like they were really a member of an international community, that was really an important thing for the society. And now I think we're 23 chapters and
growing. We
Yeah,
have some new
growing,
chapters
yeah.
that we hope comes on this year. So we're looking at Russia and India and all
What I
that.
will predict here is that maybe in the future it will be a continental issue. So we have South America, we have North America, we have Europe, and we have Southeastern and Australia continental. And then it's easier to handle instead of 40 to 60
Yes.
chapters.
No, I think you're absolutely right. And actually, we'll move that
Yes.
a little bit here at this meeting with some recommendation changes. Let me finalize two questions. You both have been giants of neuromodulation. We have a lot of young people in our society now. What I think the best thing about the society going forward is our mentoring process of young people. And at this meeting, I've saw so many young physicians and scientists and researchers who we are working together with, young women, young men who are doing a great job. What words of advice, just for our younger doctors and scientists, what words of advice, Michael, we'll start with you. If you had to give them a thought to guide their career, what would you recommend to them?
I would say that they should marry the clinical and literature data, in other words, the literature that's coming from the scientific community, that the clinical activity should never be too far removed from the scientific information. Because I think that's been much of our weakness, not just us, this group, but clinicians generally, over the last many decades. So it's listening to both sides, the scientific input and obviously the clinical practice and progress.
Very good. I think that's great advice. Elliot?
Yeah, I have a lot of advice. I was in private practice my whole life, and I knew when I started my practice, private practice of pain medicine didn't exist. So we had to answer questions, solve the questions, and publish our data to make any inroads into our community. And I told all my fellows, there are several things in your daddy. He told you, never stop asking questions. You said that today, and I always tell my fellows, never stop asking questions. I said, tell them, make a difference in your field, that anybody can make an income, but only people who really are interested make a difference. And then the last thing I said was publish. That's really important. So,
Excellent points. Mike, same question to you.
Yeah, we have an informal dinner on Sunday, nice dinner. And Michael told me that, and I completely agree, that he's never satisfied, never with his presentations. He always likes to improve. So I think that the major issue for researchers that start a career is don't get upset, don't be frustrated when it fails, because the outcomes of investigations will always be different from what you expect. And from there on, you can continue.
Yes.
But don't get frustrated with the results.
Yeah, very good point.
Yes.
So, Michael, other thoughts before we close? Any other thoughts you want to leave us with as the new giant of neuromodulation winner?
No, as I said, I made the simile between the amount of data that's coming out every day. Every day I go to PubMed and there's another paper of some aspect of pathophysiology of this condition and neuromodulation. It's just an explosion that's taking place. And our responsibility now is to try and sort out from all the outflow of this explosion which are the most promising leads to take, because otherwise it's going to be total confusion.
Very good. I think that's great advice. And this has been an INS discussion with three of our leaders of our field, both of society and the field in general. Thank you so much for joining us. I'll say to the young colleagues out there, put your patient first always, and that's in your research and your clinical work and all you do, and that will always lead you to success. If the patient safety and efficacy is first, everything else will follow. Thank you so much for joining us. The INS is proud of our members, proud of our leaders, and proud of those of you who joined us in the goal of helping our patients. Have a great day.